Hello, and welcome to certification training to become an Ombudsman Associate. Today's session will lay the foundation of how our program began, explain what our roles and responsibilities as Ombudsman are, and give an overview of the authority we have to work in long-term care settings. This presentation should take approximately 1 hour to complete. These are the areas that we will be focusing on in our training today. We will go over an overview and history of the Long-Term Care Ombudsman Program. We will discuss ethics and conflicts of interest, and we will go over Long-Term Care Ombudsman Program roles and responsibilities. Our goal is to be able to give you the information that you need to understand the history of the Ombudsman Program and the structure we have here in Ohio. We will also give you an overview of the laws and rules that govern the program and give us the authority to perform our roles and responsibilities. Finally, we will cover the Ombudsman Code of Ethics, the Ohio Ethics Law, and address the importance of understanding what conflicts of interest are and why we need to be mindful of any that we might have. We're going to start out with an overview of how the Long-Term Care Ombudsman Program started, who we are, and where we are today. To help set the stage for today's session, I want to start by sharing with you the mission of our office. The mission of the Office of the State Long-Term Care Ombudsman Program, of which you will be representatives once you complete your certification, is to advocate for excellence in long-term services and supports wherever consumers live. This means that we advocate for more than just people who live in a long-term care setting. Even though this will be your primary focus of your work as Ombudsman Associates, we also advocate for people receiving home care, those who live in assisted livings, and those who live in a few other settings we will talk about later. We do this by working to resolve complaints about services, making regular visits to providers, helping people select a provider, providing information about benefits and consumer rights, and commenting on public policy, among a long list of other responsibilities. We want you to know this mission statement and use it to guide your work as an ombudsman. Here are just a few of the unique characteristics of the Long-Term Care Ombudsman Program. Some of these characteristics won't apply to you as volunteers or Ombudsman Associates, but it's still important to understand what makes us different from other types of ombudsmen. We'll begin at the top with an icon of the state ombudsman steering our ship. Each state has an office of the state long-term care ombudsman, headed by a full-time state long-term care ombudsman who directs the program statewide. In Ohio, our state ombudsman is currently Leilani Pelletier. As our state ombudsman, Leilani designates staff and volunteers as representatives to directly serve residents. Our state ombudsman hosts webinars several times a year for volunteers, and you'll be invited to other continuing education opportunities, and will also get to meet our state staff. Moving to the second point there, our program has specific conflict of interest provisions. You recall going through a conflict of interest screening before beginning training, and will do so at least annually for as long as you remain an ombudsman. We ask things like, have you or any members of your immediate family or household ever been employed by a long-term care provider? And do you have a member of your immediate family or household that is living in a long-term care setting or is a recipient of long-term care services? We ask about these things so that we can ensure that residents have access to effective, independent, and credible ombudsman services. Let me give you an example. If an ombudsman spouse takes a job in a nursing home that the ombudsman is assigned to, there's the potential that the ombudsman may acquire different feelings about the provider. He or she may learn about the provider from their spouse that could cloud their judgment. Residents rely on us to be their independent advocates, so this is a serious issue. So it's vitally important to tell if you ever think you might have a new conflict of interest. Having a conflict of interest isn't a bad thing, and it doesn't mean that you can't still be an ombudsman in many cases. It just means we need to review the conflict and determine about how to best proceed to ensure that we're serving residents to the very best of our ability. Moving on to the third point, Ombudsmen pursue administrative, legal, and other remedies on behalf of residents. Our state ombudsman determines positions of the office. Staff ombudsmen are engaged in this work and use what we learn from volunteers to inform policy positions. For example, through your reports and the data that staff ombudsmen provide to the state office, the state ombudsman knows that staffing in nursing homes is a problem that leads to slow response to call lights, late meals, and so on. When it's time to comment on the health department's nursing home staffing rules, the state ombudsman uses our information to make a case for changes. Moving on to the final point on this slide, the Federal Older Americans Act prohibits a long-term care provider or other entity, employee, or individual from engaging in willful interference. Willful interference is defined as any action or inaction that is intended to prevent, interfere with, or impede a representative of the office from exercising any of an ombudsman's rights or duties. Anyone that engages in willful interference may be subject to a criminal or civil penalty of up to $500. So what this means in practice is that an ombudsman should never be blocked from entering a long-term care provider or have a staff person require them to be escorted while in the building. If these issues ever come up, call us immediately so we can work through them with you and the provider. In the history of Ohio's program, only one provider has been fined, and the state ombudsman has had to write only a handful of letters educating providers. It shouldn't be an issue for you. Most providers are quite cooperative. Back at the top of the screen here, ombudsmen are client and resident directed. This means that we work at the direction of our client. A guiding principle for our work, and one that you'll often hear us say, is who is my client and what is their goal? Not what their family wants or what the nursing facility wants or what other medical professionals want. Our foundation is who is our client and what is our goal. We are also impartial in investigation, but we are advocates in resolution. So this means that we gather information to find the root cause of a problem. We want to know the facts and we want to investigate to gather those. But our main goal is to resolve an issue to the resident's satisfaction. Ombudsmen use regulations and laws as a beginning point, not an end point, meaning that we aren't regulators, but we know aspects of the regulations to provide context for our work. Ombudsmen seek resolution to both individual concerns and systemic issues. The Long-Term Care Ombudsman Program is unique in the Older Americans Act and Ohio law because it addresses concerns of individual residents, calls upon others to fulfill their responsibilities to residents, for example, like provider staff or the Ohio Department of Health or managed care plans, and gives a public voice to residents' needs by working for supportive public policy, which could be found in legislative and regulatory changes. Finally, the last point on this slide, ombudsmen have strict confidentiality provisions that are at the foundation of the work we do. Ombudsmen cannot share information without resident consent to do so. We will talk about this in a later module and during some field work, as this is an incredibly important concept for all of us to know. Now that we understand who we are as ombudsmen and what makes us unique, we'll talk about the history of the Ombudsman Program along with some of the milestones along the way. We'll start at the beginning. Nearly 60 years ago, in 1965, the Older Americans Act was signed into law. It required each state to have an ombudsman program beginning in the 1970s. It was also the beginning of Medicare and Medicaid, and as public money became available for nursing home care, the industry started to grow, but there was little oversight. The Ombudsman Program was created out of an effort by the federal government to address widely reported problems of abuse, neglect, and substandard care in nursing homes nationwide. In 1978, amendments to the Older Americans Act passed by Congress required every state to have an ombudsman program and specifically defined ombudsman functions and responsibilities. In 1981, Older Americans Act amendments expanded ombudsman program coverage to include board and care homes. The name was changed from Nursing Home Ombudsman to Long-Term Care Ombudsman to reflect this change. Other duties remained substantially the same. 1987 was an important year for the Ombudsman program, with amendments to the Older Americans Act that strengthened our role and authority. Older Americans Act amendments made substantial changes in the Ombudsman program, including requiring states to provide for Ombudsman access to residents and residents' records, immunity to Ombudsmen for the good faith performance of their duties, and prohibitions against willful interference with the official duties of an Ombudsman and/or retaliation against a resident, employee, or other individual for filing a complaint or assisting representatives of the program in the performance of their duties. And in 1992, the Older Americans Act was strengthened again. The Ombudsman program was set apart in its own chapter of the Older Americans Act into the section for vulnerable elder rights protection activities. The Office of the Long-Term Care Ombudsman Program was established with a director, and funding was given to maintain a national long-term care ombudsman resource center. This still remains an outstanding resource for ombudsmen across the country today. In 1988, Ohio expanded its role to providing services for people receiving long-term care services and supports in their homes. As it stands, our program is one of about a dozen states that provide these services to consumers. Changes in 1990 and 1991 set the course for the way the program would operate. The Ohio Ombudsman Enabling Law went into effect in 1990. This law defines the role and scope of the program. Shortly thereafter, in 1991, administrative rules were adopted that outline how the laws were to be implemented. For example, there are rules about being certified and what the duties of an ombudsman associate are, and a rule about how we investigate complaints and document our work. In 2014, the office was selected by the Centers for Medicare and Medicaid Services, or CMS as we may call it, to provide ombudsman services to MyCare Ohio members. MyCare Ohio is a system of managed care plans that coordinate the delivery of benefits and services to Ohioans who are eligible for both Medicare and Medicaid. Currently, 7 out of the 12 regional ombudsman programs in Ohio operate in MyCare regions and provide these services to consumers. Currently in Region 9, as of 2024, we do not have MyCare in our region, but in 2026, MyCare is expected to expand. MyCare Ohio members are broken down into 3 primary categorizations: those in nursing homes, those receiving waiver services in the community, such as in-home personal care services, and those we call community well, who are not accessing long-term services and supports at this time. In 2019, through budget advocacy at the state and local levels, the Ombudsman program received a significant increase in state funding to expand its volunteer corps. With these new funds, regional programs were able to hire full-time volunteer coordinators, and at the state office, a state-level volunteer coordinator was hired to help regional programs' volunteer management practices. This was the first major funding expansion to the program since 2005. Now that we've covered unique aspects of the program and have touched on some of the history and major milestones, let's talk a bit about the structure of the Office of the State Long-Term Care Ombudsman. We call it the office. As you know, the Older Americans Act requires each state to have a state long-term care ombudsman who oversees operations of the program statewide. It's important to emphasize, though, that we are a part of this unified office. It includes all representatives, both paid staff and volunteers, from across Ohio. There are 12 regional ombudsman programs throughout Ohio, and there will be a map on the next slide of where all the regions are located. The administration of each of these programs is overseen by the state ombudsman. The office is housed within the Ohio Department of Aging, but operates as a separate and distinct entity. The Older Americans Act requires that the office be a distinct entity, separately identifiable from the Ohio Department of Aging. This includes the ability for the state ombudsman to make certain determinations which represent positions of the office and not necessarily those of the Ohio Department of Aging. While the state ombudsman reports to the director of the Ohio Department of Aging, it is possible that in her role as Ohio's long-term care resident advocate, her position may differ from the director's. As I mentioned on the previous slide, the office is comprised of 12 regional long-term care ombudsman programs made up of approximately 100 regional ombudsman staff and about 200 volunteers. That number continues to grow each year, which we are very happy about. The regions in which these programs operate align with planning and service areas of Ohio's 12 area agencies on aging. Long-term care ombudsman programs are housed in sponsoring agencies. Some are area agencies on aging or legal service providers. The largest program is a standalone nonprofit which covers the Cleveland metro area, or Region 10A. The state ombudsman designates sponsoring agencies and gives them grants to operate. Some federal funds are passed through the area agencies on aging and distributed according to formulas that consider several factors. Other federal funds and state funds flow directly from the office to regional programs. Here in Region 9, you can see we cover 9 counties. Our sponsoring agency is Direction Home, and that actually is the area agency on aging for Region 10B. So our Elder Rights Office consists of ombudsmen in Region 9 as well as 10B. This slide shows the activities that ombudsmen engage in. These are our core services, essentially what we do on a daily basis. These include complaint handling, regular presence visits to our long-term care facilities, providing information and assistance to individuals, providing community and provider education, other advocacy, participating in the Ohio Department of Health survey process, providing information and assistance to long-term care providers, providing selection assistance for those who have family or are looking to move into a long-term care facility, and work with resident and family councils. The Federal Administration on Aging of the Administration for Community Living administers the National Ombudsman Reporting System. This system requires state ombudsman offices to report all ombudsman activities. For Ohio, we collect information on all core services that we provide in a system we call OTIS. OTIS stands for Ombudsman Documentation and Information System. OTIS is a database used to report ombudsman activity, advocacy work, complaint handling, training, and program management. OTIS is a database designed to compile data regarding activities of each representative of the office. Reports can be generated in OTIS that can be used to demonstrate the ombudsman program's effectiveness. OTIS is crucial to analyzing ombudsman activity for purposes of systems advocacy through identifying trends, quality assurance, and demonstrating program effectiveness for funding. While OTIS is used to document ombudsman activity, it is not a timekeeping system, as not all activity is documentable in OTIS. Now we will dive into the Ombudsman Code of Ethics. When we talk about ethics, we'll be talking about two different things. One is the Ombudsman Code of Ethics. Think of this as a set of guiding principles. The other is the Ohio Ethics Law. Over the next few minutes, we'll talk about each and how they apply to you as representatives of the Office of the State Long-Term Care Ombudsman. All ombudsmen, both staff and volunteers, must adhere to these guiding principles. Regardless of an ombudsman's certification level or the complexity of the issue or problem which is being addressed, there is a basic set of principles which guide an ombudsman's decisions. The National Association of State Long-Term Care Ombudsman Programs developed this code of ethics to guide ombudsman practice for nationwide consistency. A few of the code of ethics on this slide that you will see is the Ombudsman provides services with respect for human dignity and the individuality of the client, unrestricted by considerations of age, social or economic status, personal characteristics, or lifestyle choices. The Ombudsman respects and promotes the client's right to self-determination. The Ombudsman makes every reasonable effort to ascertain and act in accordance with the client's wishes. The Ombudsman acts to protect vulnerable individuals from abuse and neglect. The Ombudsman maintains competence in areas relevant to the long-term care system, especially regulatory and legislative information and long-term care service options. The Ombudsman acts in accordance with the standards and practices of the Long-Term Care Ombudsman Program and with respect for the policies of the sponsoring organization. The Ombudsman will provide professional advocacy services unrestricted by his or her personal belief or opinion. The Ombudsman participates in efforts to promote a quality long-term care system. The Ombudsman participates in efforts to maintain and promote the integrity of the Long-Term Care Ombudsman Program. The Ombudsman supports a strict conflict of interest standard which prohibits any financial interest in the delivery or provision of nursing homes, board-and care services, or other long-term care services which are within the scope of involvement. And the Ombudsman shall conduct him or herself in a manner in which will strengthen the statewide and national Ombudsman network. Once you become a certified Ombudsman Associate, you will officially be a representative of the Office of the State Long-Term Care Ombudsman. This means that you are subject to the Ohio Ethics Law. The Ohio Ethics Law is outlined in Chapter 102 of the Ohio Revised Code. The main section that you need to be aware of concerns the subject of gifts, and the other is conflicts of interest. The subject of gifts is one that might come up frequently in your role as an Ombudsman Associate. Our goal is to help people resolve their complaints, and they may want to show you their gratitude through giving you a gift. This is where the ethics law come into play. There are 2 points to gifts that you need to know. The ethics law states that we cannot accept things of value that could have a substantial and improper influence. What this means is that you cannot accept gifts from consumers for which we advocate, from their families, or from the facilities in which we do advocate. You were screened for any conflicts of interest prior to becoming a volunteer and a candidate for certification. The Ohio Ethics Law prohibits us from acting on any conflicts of interest that we might have. This is, in part, why we do not allow you to be assigned to a provider in which you have or have had a loved one receive care, or in which you have previously worked. It is not illegal to have a conflict, but it is a problem if you act on it. Ombudsmen are consumer-focused, so getting consent from the consumer and the complainant is the cornerstone of our work. As you know, our code of ethics includes respecting self-determination and confidentiality. You must obtain consent to reveal the identity of anyone participating in an investigation, including complainants and clients. We also always need the resident's consent to share his or her identity. Only if resident does not have capacity can we act on consent of a legal representative or a resident sponsor, like an engaged family member. Consent should never be assumed. Verbal consent may be a necessary first step if your access to the resident is limited. However, written consent we do prefer. Sometimes a resident will not give consent to investigate, or a resident will not give you consent to reveal their identity, fearing retaliation. We will explore the idea of consent and how to proceed in investigating and resolving complaints when consent is limited or withheld by the complainant in a later module of this training. Our last section today will cover the roles and responsibilities of the representatives of the Office of the State Long-Term Care Ombudsman. Here are some of the specific activities that volunteers help us with. These include outreach through regular presence, observation in facilities, complaint intake, providing information about the Long-Term Care Ombudsman program, make requests of provider staff on behalf of residents with their consent, provide written reports and documentation on your activities. Some volunteers also assist with public presentations, whether that's resident council or health fairs, and assisting staff with handling of complaints. Here are just a few more responsibilities of the Long-Term Care Ombudsman. We want to empower residents. Empowerment is the process of becoming more confident and gaining more control of one's life. The Long-Term Care Ombudsman program has a responsibility to empower residents to advocate on their own behalf. We can take the following actions to empower residents. We can educate residents on their rights, educate residents and consumers on their options, discuss all possible outcomes, and encourage residents to do something about their concerns, their needs, or their wishes. We're also responsible to ensure confidentiality. There are strict federal requirements regarding disclosure of long-term care ombudsman information. Example being resident and complainant identity, case documentation, and the specific complaint. Resident identifying information cannot be shared with anyone without the permission of the resident's representative, the state ombudsman, or even a court order. Confidentiality and disclosure of information is covered in more detail in a later module. We also want to represent the interests of the resident or consumer. We do this through individual and systems advocacy. The Ombudsman and representatives work with and on behalf of residents to ensure their voice is heard during complaint resolution, through legislation, and through media outlets. Finally, the last bullet point on this slide is we want to educate. The Ombudsman program is responsible for educating residents, family members, provider staff, state and local agencies, community members, and others about residents' rights, good care practices, long-term services and supports, and the Ombudsman program. This is just a breakdown of the 3 different certification levels possible in our program, as well as the continuing education requirements. Volunteers are generally certified at the Ombudsman Associate level, but some do go on to be certified as Ombudsman Specialists. One of the ways Ombudsman volunteers get CEUs is through webinars hosted by the State Ombudsman. These webinars are open to all volunteers, and information will be sent out to you about how to participate. The State Ombudsman will provide timely information on trending issues and also likes to hear from you about how things are going. Like I mentioned, Ombudsman Associates are representatives of the Office of the State Long-Term Care Ombudsman. As representatives of the office, you are subject to the Ohio Ethics Law. As a self-study for this module, you'll need to complete a brief Ohio Ethics Commission online course on the Ohio ethics law. This link will be provided to you in the handout. Once this course is completed, you will receive a certificate of completion. Please provide this to your volunteer coordinator. You can either take a screenshot, take a picture with your phone, or print it out and give it to us. After the course, there's also an ethics acknowledgement form. If you would sign that and return that to your volunteer coordinator, we would greatly appreciate that. This concludes Module 1. Thanks for listening.